Greetings to all our viewers and listeners out there. This is W.C. Ballard, the CEO and Executive Director of B&A Entertainment, Boots on the Ground Breast Cancer Outreach Program. We're here to share some news about our participation in the U.S. Veteran Stand Down that was held on March 4th, 2026. Our Boots team joined U.S. Vets Las Vegas and vendors from around the Las Vegas Valley to provide services to our veterans, and we are the only minority-driven and minority-governed evidence-based program doing this in the state of Nevada. Collectively, we serviced over 500 veterans and their families there was housing, health care, food, clothing, financial assistance, and any needs you can think of to survive in today's economy. This is our third year of partnering with the U.S. Vets to assess women with scheduling and paying for their mammograms and cervical examinations, and we were excited and we welcomed them with open arms. Boots on the Ground is our flagship program. We're a nonprofit 501c3 and we're located in Southern Nevada. Our organization's total mission is promoting healthier communities and saving lives. Our goal is to increase the number of women having mammograms and cervical examinations and who also practice early detection and risk reduction. Our program focuses on all women, but especially African American and Hispanic women in Southern Nevada who are living in low-income housing complexes or underserved neighborhoods, who are uninsured or underinsured, and seniors, especially women over 40. These women often experience the greatest barriers to early detection. Many women delay or avoid screenings due to fear, misinformation, language barriers, lack of insurance, or limited access to trusted healthcare guidance. And this is where we come in. We exist to change that reality. Since 2013, our organization has delivered grassroots, culturally responsive education and navigation services directly into the communities where the need is the greatest. Back in 2023, we expanded our breast cancer outreach program model to include on-site intakes, peer navigation, and cervical cancer screenings, ensuring that women receive not only education, but hands-on, peer-to-peer guidance through the full continuum of care. We implement what we call the 5-point prevention umbrella of services: educate, collaborate, intake, navigate, and then we celebrate. We're increasingly reaching women where they live, work, worship, and socialize, traveling to 22 locations in 2025. Now I want to briefly share with you the social determinants of health that we encounter when discussing why minority women don't have mammograms. And these are the non-medical reasons. First of all, it's their environment and neighborhood, their economic stability, the health and health care that they have access to or they don't access, their education or lack of knowledge about early detection, and the social and community variance. And we'll talk more about this in another video. Now, our 2025 outcomes, we want to share a little bit of and you can get more of this information on our website, a little background on how we succeeded or our outcomes in 2025. We educated over 1,007 women who were over 50. That included 818 African American women and 164 Hispanic women. Now, 464 of them were referred to screening resources, and there were 439 referrals for mammograms and 162 for cervical examinations. And we're proud to say that incentives and decor does work. We had 44 intakes, 40 of them were for mammograms and 16 for cervical exams. Don't let the numbers confuse you. You had one lady, a couple of ladies who wanted both. And you know, when you're preparing a warm and colorful, inviting atmosphere with incentive gift bags for participants and peers with professional t-shirts and name tags, it results in more participation. Local partnerships, though, who have similar mission and goals, are vital to us getting those resources out there for the screening services, information sharing, and collaboration on referrals. Here are our 6 community health workers who are certified by the Nevada Certification Board, and we plan on adding more volunteers to the certification which BNA provides for them. And you can see the names at the bottom, and you can stop the reel if you want to see who we are and what we do. And we want to share some of our outreach volunteers at our 2025 Veteran Stand Down. So you can see what we did last year. There's Senator Rosen, who came out and greeted us, and she actually later gave us a commendation for what we were doing in the community. And we had a lot of women who came up and felt free and comfortable sharing their situations with us and being able to bond with us. And they let out a lot of things that they normally, I guess, don't share with other people. So we feel really blessed that they were able to trust us with their information and to assist them and give them guidance about getting their early detection, practicing early detection, and getting those mammograms and cervical examinations. And finally, wrapping up our little news brief, we thank our partnerships and resources that build capacity and increase community engagement for us, working and collaborating with the State Division of Public Health and Nevada Cancer Coalition provides a wealth of training, referral sources, educational opportunities, as well as in the importance of funding. And here's our list of just some of our partners, and you can go on our website for more information about what we're doing in the community and complete lists of all the churches and housing facilities and community centers that make this happen. And I thank Miss Anita Cookie Cook for her photography. She's one of our survivors. And I am Cheryl Ballard, the Executive Director, CEO, the editor, photographer, and videographer, jack of all trades in this organization. And we'll be bringing you more news. Hope you enjoyed this. And thanks again to the U.S. vets for what they do in the community.